lovelies. How have you guys been? I hope you've been good. I hope you've been taking good care of yourselves. Well, like I always say, you should remember that health is wealth. So, today we are going to be looking at a popular topic, which is cold plunge. There are numerous methods for taking a chilly plunge, such as jumping into a professional circulating cold tub, an ice bath, or a cold shower or the ocean. A cold plunge. What is it? You may picture a sauna or hot tub where you think of a spa or wellness retreat. But a bath that is icy cold? Not in that way. What therefore makes cold plunge such a popular addition to wellness routine? Experts have lauded the modality's many health and psychological advantages, from stress relief to pain management. It makes sense that sitting in almost icy water multiple times a week has turned into such a popular pastime. So, what is it? Immersing your body for an extended length of time in cold water, say 59 degrees Fahrenheit or below, is known as a cold plunge. One component of cold water treatment, also known as cold water immersion, is cold plunging. This is a practice where one submerges themselves in cold water, usually with the intention of achieving some sort of health benefit. The benefit of cold exposure to the skin also believed to include blood vessel constriction and inflammation reduction, which can briefly make the skin appear more radiant. So, what are the dangers that come with cold plunge? The first danger that we are going to be looking at today is cold shock. When the body is suddenly submerged in cold water at a temperature below 60 degrees Fahrenheit, it can induce a state of shock that impairs cognitive function and can result in irregular breathing, heart palpitations, rapid heartbeat, and blood pressure spikes. Physical incapacitation is another danger associated with cold plunging. Losing muscular control is another concern that can exacerbate the longer someone is submerged in cold water and possibly result in drowning. Experiencing weakness or exhaustion and losing control over the hands, fingers, arms, or legs are among the symptoms. Hypothermia. The body's temperature continues to drop after 1 to 3 minutes of immersion in water that is below 70 degrees Fahrenheit, increasing the danger of hypothermia, which can start at a core 95 degrees Fahrenheit, is the average body temperature. Drowning and cardiovascular events or dysfunction are additional risks or dangers that can be associated with cold plunging. To perform cold plunge therapy on consecutive days, taking breaks and scheduling sessions 2 to 3 times a week or even only once or twice when first beginning is the best. This gives your body time to recover, especially if you are physically active in other ways. How much time is ideal for a chilly plunge? It is advised that you begin with modest dosages. To build up your tolerance when initially starting out, it's acceptable to practice cold plunges in short bursts, even for 30 seconds at a time. 3 to 5 minutes is a reasonable goal time. After that, and pay attention to your body. So, who ought not to go cold plunging? Once more, cold plunge is an intense activity that not everyone should undertake. Who should not use this modality is as follows: those suffering from hypertension or cardiovascular disease, renal symptoms patients, pregnant women, individuals with hypertension, heart disease, or other circulatory issues, individuals with low basal body temperatures, pacemaker users, unless under direct medical care or with a medical clearance. So now, how can I take a cold plunge? You can practice cold water immersion in a variety of places, including cold bodies of water, local spas, specifically made tanks or plunge barrels, and outdoor or indoor tubs. It should be noted that research indicates that the ideal temperature range for cold plunge aimed at minimizing muscular pain is between 50 and 59 degrees Fahrenheit. That is about 10 and 15 degrees Celsius. For cold plunges, there are no set temperatures. Rather, the temperature varies based on customer preference, mentioning that the majority of interviewees say that they use water that is between 38 and 60 degrees Fahrenheit. Experts also advise beginners to gradually ease into the activity in order to develop a tolerance to extremely cold temperatures. For novice, a maximum of 10 to 15 minutes of cold exposure should be the goal. One might increase the duration of the cold plunge as they become more acclimated to the temperature. Frequently, the amount of time spent submerged is determined by a number of factors, such as the temperature of the water and the degree of familiarity with the procedure. Now, potential advantages of a cold plunge, or we can say, what are the potential benefits of a cold plunge? To talk about the benefits, those seeking an experience or athletes hoping to lessen tired muscles after a workout could find cold immersion interesting. Also, taking a cold plunge could help with stress management. Long-distance endurance athletes who are susceptible to heat stroke can benefit from the practice. Decreases in depressive mood, increases in positive mood, and a stronger sense of well-being is also some of the benefits that can be derived from cold plunge. On mental health, the potential effect of plunging into a cold water also helps with anxiety and sadness. Depression may be affected by cold water immersion, though this effect may be related to the inflammatory system. Other elements that are becoming more and more evident are the physical activity component and spending time in nature. Have you ever tried cold plunging? If you have, please let know how it felt the first time you tried it. And also, we would like to know your reason for trying in the first place. Please don't forget to leave these responses in the comment section below. Thank you for staying to the end of this video. Don't forget to like, share, subscribe, and please turn on the notification bell on your screen. Thank you. See you. Bye.